just kick off today's incredible event by introducing one of the fiercest advocates for the work that we all do in advancing prevention, recovery, and treatment, and has been a cornerstone of the work that we do as an administration on making sure that we are addressing the opioid misuse and heroin epidemics that are ravaging our communities across the country. I am just honored to introduce the Secretary of Health and Human Services, Secretary Sylvia Mathews Burwell.
Good afternoon and welcome to the White House. One of the most important parts of my job is to visit the communities beyond Washington and to learn from the people that we all serve. And since I started my service as secretary, I've made it a point to learn from communities about how they're fighting the opioid epidemic. I've met the mayors and city council members who are trying the best policy responses. I've had a chance to meet families helping a brother or a sister, a son or a daughter who are fighting the battle against opioid addiction. I've met the families grieving someone who has lost that battle. And I've met the survivors who've made it back from the brink of opioid overdose, many of whom have dedicated their lives now to saving others from addiction and overdose. And as many of you all know so well, this issue is a top priority for this administration, but it's also one that's touched my life personally. I grew up in Hinton, West Virginia, and my home state has consistently ranked at the top of the states with the highest rate of deaths from overdose, and have seen the devastation personally in terms of friends in my community that I have lost. But despite our losses, I find hope in this room, and that's why we're all here today. With the help of many of you all, today we've made important progress in our fight, and we're going to make more. Each of you has your own story, and I wish we could take the time to talk about each of these stories and about how each one of our 10 champions of change have lifted up their community and the work in their community and the individuals in their community. But today, I will highlight three of these champions who come to us today from different communities and different backgrounds, but bound together by a commitment to this fight. Justin Phillips, the founder of Overdose Lifeline in Indiana, lost her son Aaron from an overdose when he was just 20. In the midst of this loss, Justin dedicated her life to creating what she calls a place of hope. Today, Overdose Lifeline works to raise awareness about the dangers of heroin, reduce the stigma of addiction, and support the families who are fighting this epidemic. And Justin and Overdose Lifeline have been very, very busy. Last year, they worked with Indiana legislators to pass a bill ensuring that more family members and friends of people addicted to opioids can have the life-saving drug naloxone. The law, which was signed by the governor last April, is called Aaron's Law.